Welcome everyone. So today let's explore fetus in utero. The topic is all about the fetus position, presentation, attitude during pregnancy. So let's quickly dive in. Okay, so let's see what are we going to learn in this topic. So first is the basic terminology, which is very important that you have to understand all the terminology. Two, let's see what are the prevalence and causes. Number three, the obstetrical examination, and then number four, it will be engagement. So starting with the basic terminology first, let's learn about the presentation. So what is presentation? It is the part of the fetus which occupies the lower pole of the uterus. That means which part of the baby is occupying the lower part of the uterus here. Whichever part is present here, that is the presentation. Okay, so we have cephalic presentation, we have podalic presentation, we have a shoulder presentation. Okay, cephalic presentation consists of 96.5%, breech and podalic consist of 3%, and shoulder and other consist of 0.5%. Okay, so this is cephalic presentation because the baby's head is occupying the lower part of the uterus. Okay, this is called buttock presentation or breech presentation because the buttock is lying occupying the lower part of the uterus, and here it is the flank presentation where the baby's flank is occupying the mother's lower part of the uterus. Okay, so coming to lie, what is lie? So it is the relationship of the long axis of the fetus to the long axis of the uterus or the maternal spine. To make it more simpler, it means the relationship between the mother's spine and the baby's spine. Okay, so when we say it is a longitudinal lie, that means the baby's spine and the mother's spine is in parallel to each other. Okay, and in the same and in transverse lie, what does it mean? Oh, what is it? Sorry, it means that the baby is lying sideways across the mother's womb. Okay, across the mother's uterus. Okay, so if it is oblique, then the baby is positioned, or it's the lie is obliquely. Okay, we also have an unstable lie, which is because even after after 36 weeks of pregnancy or gestation, what happens, the position of the fetus inside the uterus, what happens, it keeps changing. Okay, and that can be due to many reason. And first it can be because of prematurity, maybe the baby is still small, or it can be it is it the other causes polyhydramnios. We also have a uterine fibroid if a mother has a uterine fibroid, and also a placenta previa also can be the reason of unstable lie. Okay. Okay, so coming to what is presenting part. Do not get confused between the presentation and presenting part. It is different, okay? So what is presenting part? It is like when you do the PV examination, so once you get into the cervix, the opening of the cervix, um, what do you feel? Which part of the presentation do you feel? That is the presenting part, okay? Presentation, as we learned earlier, it can be cephalic presentation, it can be breech presentation, it can be shoulder presentation. Okay, so if it is a cephalic presentation, when you do the PV examination, what do you feel there on that os, on that cervical os or the internal os? What do you feel? Is it the vertex that you feel, or is it the brow, the eyebrow that you feel, or is it the face that you feel? That is the presenting part. Okay, if the presentation is the breech, okay, so is it the complete breech, the only the buttocks that you are feeling it, or is it the flank that you are feeling it? Okay, or is it the foot that you are feeling it? Okay, so that is the presenting part. Okay, don't get confused. So it is the part of the presentation, it is the part of the presentation which overlies the internal os and is felt through the cervical opening. Okay, when you do the PV, the part you feel is the presenting part. Okay, So the other one is the attitude. So this is the relation of the different part of the fetus to one another, which is the head, the hand, the trunk, the relation of all these different part. Okay, so when we say what is the universal attitude, that means it is when the baby is well flexed. Okay, the head is well flexed, and the trunk and the limbs is also uh, flexed, and it forms an ovoid shape, that means like an egg shape. Then it is called a universal attitude. Okay, and when do we call it an exceptional? That is when it is a deflexed vertex, which is like this. The deflexed vertex is like this. The well flexed vertex is like this. Okay, here like this. And where if it is a deflexed vertex, then it is like this, the head is like this. Okay, and you find the brow, the brow face presentation also, and you at sometimes you also feel you can also feel extended legs. Okay, in breech presentation. Okay, so this is the uh, attitude. So now what is the denominator and the position? So denominator is the it is a specific bony point of on the presenting part. So suppose if it is the when we say it is vertex presentation. Okay, so if it is a vertex presentation, the bony part or the bony point is the occiput. Okay, so if it is face, then it is the mentum. Okay, the chin one. The chin is the bony point. Likewise, if it is the breech presentation, then it can be a sacrum. Okay, so the bony point is the, don't get um, don't get confused. It is just the bony point of the presenting part. Okay, is the denominator. Okay, and what is the position? It is the this we will learn in details in the later next slide, but it is the relation of the denominator to the different quadrants of the pelvic. Okay, okay, so the position of the vertex. Okay, so this is the pelvis, so and it is divided into 8 equal segments. Okay, and each segments is 45-degree. Okay, and here what we are trying to determine is the denominator. So now you know what is denominator. It is the bony point. Okay, so the bony point of the vertex, where is it positioned? Okay, so first, usually the most common position is the left occipito anterior, which is this part. This is the most common position. And second is the right occipito position. Sorry, anti right occipito anterior. Okay, first is the left occipital anterior, second is the right occipito anterior, and then you have the third one is the right occipito posterior, and after that the fourth position is the left occipito posterior. Okay, so this is the common position of vertex. Now let's learn why longitudinal lie and cephalic presentation dominates. What is the cause? Okay, so the first is the gravitation. So as we know that the fetus head is much heavier than the body, so and we also know that the heavier particles actually settles down on the bottom. So it's the same. So here the being the head being the heavier, that is why it comes down to the bottom of the uterus. Okay, number two, the reason is the adaptation. Since the fetus in flexion form or in the ovoid shape, it fits the uterine cavity well. Okay, in this way. Number three is the size difference. So the well flexed head circumference, the total head circumference is 27.5 centimeter, which fits better in that narrow uterine cavity. uh, whereas if it is a breach, then what happens is like the circumference of the breach with the flex thigh is 32.5, so it's a much larger diameter. Okay, so that is why it is a cephalic presentation. Okay, so now obstetrical examination or Leopold maneuver. So what is Leopold maneuver? It is a systematic palpation technique to determine the fetal position. Okay, we have four grips. First is the fundal grip, lateral grip, Paulic grip, and then pelvic grip. Okay, so fundal grip, why do we do? We do it because to determine which fetal pole is present here on the fundus. If it is head, you'll feel round and hard. If it is breech, you'll feel round and soft. Okay, so lateral position is lateral grip. Here we try to locate the baby's back and limbs and anterior shoulder. We try to locate that. Okay, in the Paulic grip, what we do? Why we do? We identify the presenting part and the mobility of that presenting part. Okay, pelvic grip, here also we check for the whether the if the presenting part is the head, whether it has been engaged or not. Okay, so that is pelvic grip. Okay, so lastly, let's see what is engagement of fetal head. Okay, so we were talking about whether the head has been engaged or not in the previous slide. So what actually it is, let's learn. So the definition is the head is said to be engaged when the greatest horizontal plane, which is the biparietal here, this two, has passed through the plane of the pelvic brim here. This two, if it has passed through the pelvic brim, then it is called the head has been engaged. So how do you diagnose this? First you need to do the abdominal examination. Okay, so first is like when both sinciput and occiput is not felt from the abdominal examination. That is when if you remember, we do a Paulic grip. Okay, where we try to hold the presenting part and try to move it, right? So that is here, that is where here in the Paulic grip we are trying to hold the sinciput and occiput and move it. Okay, so if you're not able to feel or not able to hold that, that means the head has been engaged. Okay, the other one is the divergence of the examining fingers during pelvic grip. Okay, the fourth Leopold, if you remember. So here what happens, like when you are doing the examination, your finger actually diverges. Okay, so if it diverges, that means the head has been engaged. Okay, the other is the vaginal examination. You need to do the PV. Okay, and while you do the PV, you'll feel the head of the baby on the ischial spine. Okay, so if you feel, that means the head has been engaged. Okay, so now let's talk about the significance, why we need to check for head engagement. Okay, so head engagement excludes disproportion of the pelvic rim. Okay, so here if you remember, if you know, we are here ruling out CPD. Okay, cephalopelvic disproportion. So the significance is that whether the head has been engaged or not, to check for the head engagement. So timing, when should you check for head engagement? In primary gravida, you need to check at the time when the mother is on her 38 to 42 weeks, anytime in between. Okay, once the mother is on, in her term pregnancy. Okay, or during first stage of labor. Okay, and in multigravida, when do you do? Late in the first stage after the membrane has ruptured. Okay. Thank you so much. If you like it, please do share with your friends. Do not forget to like and subscribe.